Okay guys, so in this next part of correcting shoulder, upper mid-spine and neck dysfunction, also known as upper body dysfunction, we're going to be looking at our release techniques. Okay, so at the end of the last section, that first section at the end, we looked at the overhead squat assessment and I show you the signs of dysfunction that we're looking for upper body. So that's going to be that arms fall forward or that shoulders elevate. Okay, so, and that's going to identify which muscles and structures are contributing to that dysfunction. Okay, so which muscles have become short and overactive, so short meaning tight, and overactive, and also which muscles have become lengthened and underactive, aren't working so well. So with these release techniques, we're going to be targeting the muscles that have become short and overactive. And what I mean by overactive is that there's too much drive going into them. They're kind of like tensed up almost, and we're going to use these release techniques to calm them down before we start mobilizing those joints and stretching them out. So if we do some release before we do those other techniques, we're going to get a much better result. So what we're going to do when we're doing these release techniques, if you've seen the other videos I've done on the other dysfunctions, I've spoke about this in those playlists, but when we're doing these release techniques, all we're doing, we're searching through and looking for a tender spot. Okay, so an area that feels a little bit sensitive or hypersensitive, and so they're known as trigger points, and they exist within the muscle tissue. We're going to go after those points and we're going to hold those until we start to feel like they diminish or calm down and we get like a feeling of release. Okay, so that's where we're going to use these foam rollers or those massage balls. Okay, and I'm going to talk you through how we do it. And again, we're not looking at, this shouldn't feel really uncomfortable. I'm talking, fairly uncomfortable. Just, it's going to be manageable. It's not going to be, certainly not going to be excruciating. It's just going to be, I can feel a bit of tension there. Yeah, it's a little bit uncomfortable, but I can manage it. That's all I'm talking about. Okay, so what we want to go after first, the main driver of that arms fall forward sign is going to be these big muscles, or actually our biggest muscle in our upper body being our lats. So these muscles kind of start at the side, and they kind of cover most of our back. So that's called our latissimus dorsi. So we're going to go after them first. So we want to be exploring, searching through just kind of underneath and around the shoulder blade and just down to the bottom of the rib cage. So you're going to take your foam roller, okay, and you're going to lay on your side. You're going to place the roller underneath that area, so it's just kind of underneath the side of that rib cage, and we're going to lean back slightly, because again, it mostly covers the back there, not so much around the side. We're going to lean back, and then we're just going to slightly and gradually just roll back and forth through that area until we find a sensitive spot. So as soon as you guys have found that sensitive area, you're going to find it, and then you're going to stop moving. You're going to hold it right there. We don't want to keep going up and down. All that's going to do is set off our pain receptors, and we maybe end up with an increase in activity for that muscle, which we definitely don't want that. We want to find that point, that hypersensitive point or that trigger point, hold it there until we get that release. So you're going to go through until you find that tender spot. And for the lats, they tend to be just kind of below the shoulder blade. So I've got one right here. So I'm going to lean back just a little bit. And if you want to, you can use this, you can bend this elbow and rest your head against your hand. If it's a little bit more comfortable, you can certainly do that. Again, I'm just going to hold it. I'm going to wait there. And we want to hold it for about 30 seconds to 2 minutes, or until we feel a reduction in tension and a reduction in discomfort, and then we can move on. You might find several points here, which you could do, but I want you just to find the most uncomfortable area. Again, apply moderate pressure to it so it's not too uncomfortable, and then as soon as we get that release, you're going to move on. So then you're going to go to the other side. Okay, so that's been about a minute and a half or so now. I can feel that start to calm down. I can feel that tension going away. Great, that's our first one. Okay, so that's our lats. Okay guys, so the next muscle we're going to go after is the rhomboids. Okay, so the rhomboids sit just either side of our spine between our shoulder blades. So they attach from our spine, and they kind of run down just slightly diagonally, slightly obliquely down towards the inside of the scapulas. And again, like I was saying with the pec minor release, both of these muscles, and again with the next muscle I'm going to show, they all contribute to that scapular downward rotation. So one of the reasons why we can't get our arms up high enough overhead is because our scapulars don't rotate freely. Okay, they're not having that upward effect. Okay, so again, this muscle, the rhomboids, will contribute to keeping those scapulars stuck downward as well, and they will cause that elevation and that tipping forward of the scapula. So this is definitely one we want to get out. So what we're going to do, you guys are going to need to get your massage ball. So I've got this one right here, and what we're going to do, these trigger points tend to occur, these sensitive areas, right kind of on the inside of the scapula, right down here, just where that scapula is. That's where they tend to be most of the time. You can get some a bit more in the middle, but they more or less always tend to be through here, and it does tend to be quite a lot of them as well. So, but again, we could go after all of them, but we'll be there for a very long time. So we're just going to go up and find the worst one. Okay, so what I want you guys to do, you're going to put that ball, and we're going to put it just on the inside of that scapula. Okay, so I'm going to do my right side. Okay, so I've got it right there. And I'm going to bring both hands and do like a cross-body position right here. And what that's going to do, that's going to lengthen, that's going to give me a little bit of upward rotation, what I was talking about. That's going to help to lengthen and stretch out those rhomboids and help me to pin down those sensitive tissues. Okay, so I've got that position right here, and I might need to kind of drop up and down a little bit until I find it. And again, I've got a point right there. And again, I'm just going to look forward. I'm going to keep my hands on my shoulders. I'm going to just apply. I can control the pressure quite easy on this. I can just lean back into it if I need to a little bit more. And I've got mild discomfort there. And again, I'm just going to hold it 30 seconds to 2 minutes until that goes away. And again, once that's released, I can then move on to the next muscle. Okay, so that's our rhomboid release. Okay guys, the other muscle that we want to get into that also contributes to that downward rotated position of the scapula, and also that tipping forward of the scapula that gives us that kind of rounded position. That's going to be our levator scapula. So that's going to sit just kind of underneath this big thick muscle in our neck, being our trapezius. It's going to sit just underneath there. And where this is, if you guys can see it, where I've got my fingers, is if you feel your scapula, you'll feel like this bony ridge right here. Okay, so that's the spine of our scapula. If you just come up a little bit above that, again, you'll feel like an angle, like a corner of that scapula. It might take a little bit of feeling around practice, but it's right on the inside corner of that scapula. That's where that muscle originates. And again, it comes right up into our cervical spines. It kind of comes up in this direction, but it's right there, just on that inside superior corner of that scapula, right there. Okay, and what we're going to do, we're going to put the ball. This one can be a little bit tricky. We need to stand at a little bit of an angle. I'm going to put the ball just in that area, just above that inside angle of that scapula, that superior angle of the scapula, that corner. Okay, and again, I might just have to lean back against it. I'm going to pin those tissues down, and what I can do to help pin those tissues down is I'm going to put a little bit of stretch on that muscle, and all I'm going to do is I'm going to tilt my head the opposite way, and I'm going to look away as if I'm trying to look underneath my opposite armpit. Okay, and I can also take the hand on this side and reach it across and grab the opposite side hip. I can even use my hand on this side just to control and rest my head there. And again, I'm just going to find that point. I've got it right there. And again, I'm just going to hold that position and wait. That's bringing my arm across, looking away. It's going to help to stretch out, pin down those tissues. And again, I'm just going to look, just like all the other muscles, look for the most sensitive area, have mild pressure on it, and again, wait 30 seconds to 2 minutes or until that muscle starts to calm down and release. Okay, or we get a feeling of release. we get a reduction in discomfort. Okay, so that's our levator scapular release. Okay, guys, so the next muscle that we're going to be going after and releasing is going to be the pectoralis minor. So you guys are probably familiar with these larger pectoral muscles that you have on the front. So that's our pectoralis major. Our pectoralis minor sits deep to the pec major, and it attaches to the front of the scapula, and it's going to run down this way, and it's going to attach onto the rib cage. Okay, so with this muscle and with some of the other muscles I'm going to go through afterwards, when we have that upper body dysfunction, so we have that arms fall forward, we have that scapular elevate position, what's happening there, the reason we can't quite get our arms up overhead is our scapulars can't rotate freely upwardly. Okay, so they get stuck downward in this kind of downward position, and then they kind of this kind of inside angle of our scapula kind of elevates slightly forward, so it gives that appearance of elevation, but really what's going on is we're kind of stuck in that downward position. So if I was to show you from the back, if I was to raise my arms up, I need my scapulars to rotate upwardly, okay, in order for me to get that full 180-degree straight arm overhead position. So it's very similar if you guys have ever used like a corkscrew, you push that head of the corkscrew down and those arms go up, and again you'll see like those jagged areas which are the shoulders of the corkscrew, they'll rotate as you push it down and they bring those arms up. It's very similar to us. Okay, so that kind of gets stuck downward. The other thing that happens as well is the scapulars start to tip forward, so we call that anterior tipping. They kind of come over this way a little bit, and that kind of gives us that rounded shoulder appearance. Okay, so that's another thing that happens. We need the short scapulars to be tipped backward and be able to rotate freely up, so we can bring those arms up. If they're kind of stuck downward in this position, we kind of get stuck here. Okay, we can't fully bring our arms up as well. Okay, so that's another thing that goes on, as well as like the lats being short. Like I said before, the muscles that rotate our humerus, our arms inward. Okay, we need them out of the way, but we also need to optimize those scapular mechanics. So again, the pec minor is going to be a big driver of that downward rotation and that anterior tipping. So we definitely want to go after it. Now, word of caution, guys, when we do this, we are going to be quite close to the axilla. Okay, so in the armpit, there are a ton of nerves that go through there. Okay, so we have to be a little bit careful. So if there's anything when we're doing this technique, if there's any feelings of burning or pins and needles or paresthesia, any numbness, we want to get off of it. Okay, so nerves are very, very small. They're very thin. They're only a couple of millimeters. Okay, so you might just have to move slightly, maybe a centimeter or so, and that should go away. We should be off of it. Remember, we want to be compressing muscles, not nerves. So if you do feel anything, just move until those kind of sensations dissipate and go away. But to get into this muscle, what we're going to do, we can't use a foam roller so well because it kind of bridges over that area. It's very hard to get into that muscle and get a release. So I'd recommend using either a tennis ball or one of these larger massage balls. They're going to work really well. And to get into it, what we do, if you bring your arm up, you're going to feel for that fold of the pec major. Just as you start to fold, just as you feel that fold and you start to sink your fingers into your armpit, that's where we're going to be going. So you're just going to tuck your fingers behind that pec major. That's where we're going to be going with the massage ball. So I'm going to show you guys from the front. We're going to lay on our front to do this one. And again, I'm going to bring my arm up because that's also going to put that pec minor on stretch. Again, it's going to help to pin down those tissues. So I'm going to bring that arm up and I'm going to put that ball right in that spot right there. So that's where we should be. Again, I'm going to search around. Once I've found that tender area, once I've got that spot, I'm just going to rest my head down and just relax. And again, wait 30 seconds to 2 minutes or until I get that release. Okay. Again, we'll show you guys from the side. So if I went from the side view, again, I'm going to raise that arm up. Again, just gonna tuck in right here. Okay. Right there. Bring that arm up. And again, just going to use rest my head on my hand, on my arm. And again, I'm going to wait 30 seconds to 2 minutes until I feel that release. I've got a point right there. Again, I'm just going to hold it until it goes away, so we'll get that feeling of release. Okay, and that's our pec minor release. Okay guys, so the last muscle that we're going to release is going to be our posterior deltoid. So that's the muscle on the back of our shoulder. Okay, so at this point we've done all the other muscles. We've done our lat dorsi, which was that big muscle on the back. So that muscle brings our humerus, our arm, it kind of causes it to rotate inward and contributes to that rounded shoulder position. Okay, it kind of takes our shoulders out of neutral alignment. And then what happens, because our internal rotators get really overactive, it means our external rotators, so the muscles that rotate our arms outward, rotates our shoulder outward, they get lengthened and they get underactive. So if we have that arms fall forward sign, that is essentially excessive internal rotation. So those muscles get short, those external rotators shut down, and we need them to work. Okay, that's going to help to keep our shoulder joint in optimal alignment, and it also helps to keep our arms up overhead as well, and also to stabilize that shoulder joint effectively. But what happens is when those external rotator muscles shut down, our posterior deltoid, which is also an external rotator, it's not the main external rotator, but because the main ones have shut down, that's our infraspinatus and teres minor, which I'll talk a little bit about later when it comes to the activation exercises. Basically, they're not doing their job very well, and posterior deltoid is trying to take over and do the work. But the problem in it doing so is it causes some faulty kinematics within the shoulder joint itself, which is a problem. So with this muscle, if it becomes shortened, it tends to shorten the back of the shoulder joint itself, the shoulder capsule, and it causes because the shoulder is a ball and socket joint, the humeral head, which is the ball part of that joint, causes it to kind of glide excessively forward. That can cause some possible impingement and pain in the front of the shoulder joint, and that can block and restrict optimal motion. Okay, so there's a few few problems that are going to happen with this muscle if it starts to try and take over and do the job of the other muscles that have shut down. So we do want to address it. We do want it to calm down. It is in a lengthened position, but it's one of the few muscles that get lengthened, even though it's an external rotator and it does get lengthened. It's become overactive again because it's trying to do the work of the other muscles. So we still want to release it. We're not going to stretch it. We're just going to calm it down. Okay. So then the other muscles, when it comes to us activating those, they can do it without this kind of getting in the way. So what we're going to do, we're going to be laying on our side. We're going to be putting the ball just at the back of the shoulder. So if you kind of feel that scapula, you'll feel that big bony ridge. If you kind of follow it to the end and then just kind of drop off beneath it. You can even bring your arm back slightly, just kind of as if you're trying to squeeze your shoulder back together. You'll feel some muscle kind of tense up behind you. That's going to be your posterior deltoid right in there. Okay, so, and that's where we want to be putting the ball. So again, we're going to lay just on our side. Okay, I'm going to bring this arm out in front. Okay, and I'm just going to be putting the ball right underneath the back of that shoulder, right there. Okay, again, normally I could rest my head on a foam roller. Okay, I could do that. But again, I just want to bring that arm up. If I bring that arm up there, it puts that posterior deltoid in a lengthened position. Again, I'm just going to find that tender spot. And I've got it right there. Again, I'm just going to hold 30 seconds to 2 minutes, or until I get a release. Get a release in that muscle. And that is it. That's all we're going to be doing. Okay, and then that's the end of our release techniques. Okay, so that's our posterior deltoid we did right there. Okay, and then in the next videos, we're going to be looking at doing our mobilization technique. So look out for that next video.